Hi guys, Tiffany here. I just wanted to do a quick update about a little procedure I had this week. My first video I talked about one of the main reasons I wanted to have the surgery was my PCOS, and I've had some issues with my PCOS the past 4 months, so if you're a guy or you get grossed out easily, you might want to step away. But I thought I would post this in order to maybe help somebody else that has had such bad issues. I have an extreme case of PCOS. You don't necessarily have to have cyst on your ovaries. I do. I had extreme facial hair. You can still see some of it kind of coming back. I did have to have laser surgery, but a lot of my pictures I would kind of hide my face in because I had even though I had to shave it every day and waxing didn't work, it basically looked like I had a goatee. By far, probably one of the most humiliating things when it came to my PCOS. My cycles have been really irregular. I can go a year and not have one, and then just recently, from about May 7th until this past weekend, I've had almost a constant cycle, back and forth between full-blown to just spotting. I've worked back and forth with my OBGYN. I'd been to several doctor's appointments, had to get on iron supplements because of all the bleeding, tried birth control, I've tried metformin, I've tried Prevera. Somebody had asked me about the Lupron injections. Really, with what I had going on, that wouldn't really work. They do really well for bleeding, but like I said, I can go a year without it, so that really wasn't an option for me. So ultimately, I went to like my 4th appointment last week, and we decided that I would have surgery. So I had surgery on Monday. They went in and removed 2 polyps. They were right near like where my tubes go into my uterus, which could have been a cause of a lot of the bleeding. And also they did a D&C where they kind of clean out your uterine lining, and in preparation for surgery, since I haven't been on any type of birth control, and really birth control doesn't help regulate me, they did, now that the polyps are gone and the lining's cleaned out, they did insert an IUD, which we're thinking will help keep my lining thin so I won't have this issue again. But also, it's a form of birth control that I can use, and it'll be pretty easy to use with the surgery coming up. So that kind of checks that off the list too. So anyway, I just kind of want to let everybody know what was going on and what step I'm at. So that's really it. I got that taken care of. So now I have the birth control option. I already had my first, let's think, I've had all my labs done. I've went to the seminar. I've had my first official consult, and she just, kind of let me know what I will be, should eat, what I should try to eat. This doctor's office actually has a nurse prac. They have a doctor that works with you as far as your medical conditions. So like my PCOS, the surgeon, an exercise physiologist, and a registered dietitian. So by my next appointment, I need 1 more year of weight history. I got to get that in. So I have 4 years, but there was a year that I skipped because I was moving, and I don't think I even went to the doctor that year. So yeah, that's really where I stand right now. My next appointment is actually September 6th is my psych eval. September 13th is my official dietitian appointment, but my second visit with the facility. And then after that, I'm hoping I'll be getting closer to a date. I know it kind of gets hard because this is getting close to the end of the year and the holidays. So by the time I finish up all my months required by my insurance, it basically will be the beginning of November. So I'm not 100% sure if they can get me in before the end of the year. And also just trying to look at PTO and that sort of thing. I'd posted a question out on Instagram. If you have Instagram, mine is Latteedah, LATEEDAH_VSG. And I just asked if people would mention it to their bosses. I haven't said anything to mine, but I'm a nurse, and I actually work for an insurance company that does pre-search for bariatric surgery. It's not the insurance I have. We have military insurance, but anyway, so I kind of know how the process works. But I think my boss will be really understanding. I think I'm actually getting ready to tell her, because just in the next couple weeks between follow-up from my surgery I had this week and my 2 appointments for VSG, I actually have 3 appointments in the next 2 weeks. So I just do want to give her a heads up about what's going on, even though I know I'm not required. So yeah, that's really about it. That's all I really have. I know, not super interesting. I'm sure as time goes on, maybe my post will be a little more interesting and a little more fun. Anyway, so hopefully maybe this is informative for somebody, and if not, just stick around because I know they will get better. But I hope you all have a great day. Talk to you soon. Bye.